If you've ever felt frustrated or confused about getting medical care approved by the insurance company, Medicare Advantage plan, Medicare Supplement plan, especially with all the changes that's going on with these plans, you're not alone. And so today we're going to do a deep dive into what prior authorization really means, why it's becoming more common, and how you can stay one step ahead. So grab your favorite beverage and let's work on this together. So, first of all, what is prior authorization? Let's start with the basics. So, prior authorization is when an insurance company requires your doctor to get approval before they perform certain procedures, hospitalizations, or even medications. And it's like a permission slip from your insurer. So it's happening more with Medicare Advantage plans now, and even the supplement plans that, if you had a Medicare supplement plan with Medicare, I mean, you didn't have to worry about anything. Well, now even the supplemental plans with the insurance companies are getting on the bandwagon with needing prior authorization. So I was reading an article to kind of prepare and make sure that I had all the facts and everything for everyone this evening. I was reading an article, and the article actually went on to say, and I will include that in a resource. I'll share it in the comments and also in the video description for those of you that will catch this on the replay on our YouTube channel. So ARP actually did a survey, and they found that more than 60% of family caregivers had experienced delays for their aging loved ones due to insurance hurdles. So that means where treatments are getting delayed. In one of the articles, they actually quoted a person. She said, this is an Angela D. from San Antonio, Texas, actually quoted her by saying, as my mom's caregiver, I had to reschedule physical therapy multiple times while waiting for insurance approval. Anything that speeds that up is a godsend. So, it's out there, and people are challenged by it, and people don't understand. A lot of people don't understand. And when we're dealing with solo agers, or we're dealing with aging adults that don't really have a lot of family backup or people to help coach them or help them navigate through the healthcare system, they're really being confused by all of this. One personal story I had, we had a client that was struggling with some mental health issues, and she found a provider that she really liked, and she was so excited about it. She went ahead and booked this session. Before talking with me, we had a plan in place to talk about it first, because I wanted to make sure that the provider that she chose was going to be in network with her insurance company. If not, if you're net, and in network is a little bit different than prior auth, but they kind of go hand in hand. So prior authorization could mean, checking with your insurance company to make sure that a provider that you want to see is in network. If you have an insurance plan that requires you to see a network provider and you see someone outside of your network, they're not going to pay the bill. And this is what happened in this case, is that she left it in the hands of the clinic, the behavioral health clinic, to get prior authorization from the insurance company to improve her mental health visits. They were in the process. This went on, and this lasted for weeks. In the meantime, she was seeing this provider that she really liked, and they really hit it off and had a good connection, only to get an $800 bill in the mail and saying they're not a preferred provider. They're not in network. The prior authorization was denied. So I worked with her on, appealing. It took us weeks, and we had to appeal in writing. She had to have a hearing on the phone with the insurance company. And finally, just digging as deep as we could, the one provider, the only sole provider that was at that clinic, happened to be in network with her insurance company. The other providers that she saw in the beginning while things were getting set up definitely were not. So they're having to, make payments to pay, that bill for those services that were not authorized or were denied. So this is the reality of this. You have someone who maybe has a stroke, or someone who's leaving the hospital, going home and needing home health care or needing physical therapy. Maybe, you're going to an outpatient physical therapy, and now you're waiting weeks, because you're waiting for the doctors to be able to get authorization from the insurance company. Otherwise, if they don't, you will get the bill. And so Medicare Advantage plans have traditionally, in particular, are using prior authorizations more often to control costs. And this means that you might need to get approval for things like surgeries, knee, hip, back, some of those hip and knees that we consider pretty routine. Outpatient procedures such as x-rays, MRIs, therapy, infusion therapy, things like chemotherapy, radiation, immunotherapy, those types of things all need to get the prior authorization from the insurance company before you start, or they can pass that bill on to you. Even hospital stays. And I know this doesn't exactly go with prior auth, but it's another way in the same bucket of things where you can get stuck. And that's going to the hospital and not being aware if you are in observation, which is an outpatient status, or if you truly are an inpatient. Now, from being in a utilization review nurse position in the hospital prior to retirement, I was the one that went around and got these forms signed informing people that they were in an observation status. I hated it. I hated being a nurse, wanting to care and nurture for these people being put in that position. But the reason I bring this up is because I know that there are forms that you need to sign to make you aware that you're in observation status. The problem is that a lot of people don't understand what that means. And so observation status means you're not really admitted to the hospital. It's like staying in the emergency room for 48 hours. You're an outpatient. Only when your care is expected to last 2 midnights or more over a course of 48 hours or more, that you have an illness that requires more intensive services, will you then be considered an inpatient? So it's real important when you're looking at your Medicare plans, how many days are you going to be responsible for paying while you're in the hospital, and at what point in time does the insurance company pick up the rest of the bill? So these are all things that people really need to be aware of. And I know in this short Tuesday tips, this evening, that we're not going to be able to teach you everything that you need to know. But the most important thing we want to share with you is that you're not alone. If you're struggling with navigating this, or not understanding your insurance, or not understanding your prior authorization, we can help you. Reach out to your Aging and Disability Resource Center of your county. You can reach out to us as advocates, reach out to your clinic, to the social worker, or reach out to your insurance advisor that signs you up with your Medicare plans. There are resources out there for you to do. So please don't think that you have to go this alone. But if you get anything out of this Tuesday tips at all this week, is to know that if you're going to need an expensive medication, a medication that's like tier 3, 4, 5, chemo, surgery, a procedure, therapy, just know that that's a red flag. Then you need to ask the question, is the prior authorization there? Is my insurance, do we have something in writing saying my insurance is going to pay for this? Just be aware that process exists, and make sure that you ask so that you don't get any of those surprise bills, in the mail. So this whole prior authorization process is, it's not just a formality. If you skip this step, bottom line is your insurance may not pay for your care. Okay, so what does this mean for you? Let's talk about what this means for you as an insured. It means delays. You might experience delays in care if paperwork isn't filed correctly or quickly, and the poor doctors and the doctor's offices are expected to do all of these things. For example, if you want to have knee surgery and knee replacement, the insurance company is going to require documentation that you receive conservative treatment first. Physical therapy, maybe cortisone injections, maybe the gel injections. They're going to need to see a progression that you've tried all the less expensive things first before they're going to go ahead and approve your surgery. So it's just real important that we know that this system of prior authorization exists, and we just have to learn how to play that game. and to stay a step ahead. So insurance often requires you to try, we talked about the conservative treatments, documentation. The doctors in the provider's office are expected to just have a lot of documentation that needs to be submitted with detailed records showing that you've tried conservative measures, that there is nothing left, that this is the only other option for you. And sometimes, even if everything is right, approvals can be denied or sent back for clarification, more information. They might say that it's incomplete. They don't have enough information to make a determination. And again, all the time that this is going on, your care could be delayed. So let's use another real world example. We went over the knee surgery and we talked about that briefly. So let's break that down and look at how a conservative treatment pattern might look. So number one, it could be several weeks or months of physical therapy. We talked about doing anti-inflammatory medications, steroid injections, and then each step of the way, the doctor has to put in your chart, in your record, that these steps either worked or they did not work. And then we have to see this paper trail of all the things that they've tried in order for the insurance company to be satisfied with that. So only after these steps and the paperwork to prove it will the surgery be approved. And the same goes for other procedures. Sometimes you must show that you've tried less invasive options first. So there's also a troubling trend going on that some insurance plans, they're listing preferred providers in their directories who really aren't providers. And this is really important that we need to stay on top of your provider list all the time. So each insurance company has a list. You can go online, or if you're an aging adult, need a little help with this, maybe a family member, a friend, or can reach out to us, can help you go through that formulary. Because if the doctor's wanting to put you on a medication and the medication doesn't necessarily require a prior authorization, you might still get denied, and you might get a big copay for that because it wasn't the drug in that classification of medications that was on the formulary, the preferred drugs that your insurance company pays for. And so a good example would be the blood thinners like Eliquis or Xarelto. You might have an insurance company have one of them on their formulary, but they don't have the other. And if the doctor orders the other, then you could get stuck with that big copay. So it's always buyer beware. So it's always want to make sure that we check your formulary, that we make sure that the medication is covered, what tier it's in, and what is your expected copay. And so there's been articles that have been talking about this thing, and that there are this issue with prior authorization. There's some steps going on within the government too to try and help. We're going to go over that a little bit, but I also will include those articles for you for further review. So let's look at some best practices. What are some tips for you to stay ahead of the prior authorization process? So ask early. Always ask your doctor if a procedure or test needs prior authorization. They have a department in the hospital, the clinics, they all have a billing and coding department. They have a group of employees that this is what their job is to work with the insurance companies to make sure that things are coded properly, make sure that they're getting prior authorization. So they do have the people that can help with this. And make sure that you have prior authorization before it's scheduled, because there's nothing worse than having to reschedule after you've made arrangements and plans for your recovery, only to find out that you have to reschedule. Number 2, get it in writing. Request copies of all paperwork submitted for authorization. Don't wait till weeks go by when maybe you get your explanation of benefits or your EOB from the insurance company, or you get the letter. I mean, it might be too late by then. So make sure that because the hospitals and the doctor's offices, they will get something in writing that states that the prior authorization, they get a number, and it's a very formal process. So ask to see that, or get a copy of that better. Track the process. Follow up with your doctor's office and in your insurance company. Don't assume it's moving forward. If you feel like there's delays, take that ball and run with it. Contact your insurance company and ask them where we are in the prior auth process. I did this with my mom. And so My mom had an insurance company that denied her back surgery. And they said it was not covered by Medicare, but yet several years ago it was covered. So the manufacturer company, she was going to have a back surgery, had to put some discs in to lift up her vertebrae to take the pressure off her nerves and help to relieve her pain. It was an outpatient surgery, simple procedure, just a day surgery. And the manufacturing company says that, they've been taking this particular insurance company to court because they've been denying the surgeries. And so we went to court. It was taken care of. The insurance company was ordered to pay for the procedure. And then we still didn't schedule it because me, having some background knowledge, I wanted something in writing. I wanted to see the authorization. So I called the insurance company myself on my mom's behalf. I had my mom on the phone with me. And I asked if it was approved, and they said, no, it's still denied. I says, well, how can it still be denied when the court has ordered you to pay for this procedure? Well, the insurance company replied by saying, well, we're going to appeal to the Medicare board and it's going to be tied up for months. So it was just a very disappointing experience. But the plus side is that this all occurred during the annual enrollment period. So I was able to find another insurance company, another Medicare Advantage plan for my mom. We switched her over. It started January 1st. She saw the new doctor. She saw everybody she needed to see. She had her surgery by March. Everything was approved. No questions asked. So I don't want you to think that this video or this Tuesday Tips is trying to, I guess, bash, for a lack of a professional term, the insurance companies. But I'm saying this to just point out the importance of being diligent in this prior authorization process and knowing sometimes there's a lot of bumps. And I'm hoping soon that they will make some headway. And we'll talk about that in a little bit. So, number 4, know your rights. If a claim is denied, you have the right to appeal. Ask for the denial reason in writing. Now, here's another thing where you need to be careful. Every insurance company has a different denial process. We used to get the doctors involved to do a peer-to-peer with a medical director from the insurance company. They would kind of duke it out over the clinical aspects, and then there would be a determination, okay, we'll overturn the denial, or yes, we're going to uphold the denial, or you may have to appeal in writing, and there's not an indefinite amount of time that you can appeal. So it's really important to know the appeal process for your insurance company, because it may have only a certain amount of time that they're going to allow you to appeal. Number 5, check your provider status. Call providers directly, or ask to speak to the billing or the insurance, the prior auth department. Directly confirm that your provider is a network, even if it's listed on your insurer's website. Doctors come and go. They come, during the year after the contracts are already done. So something could just be missed in the paperwork, so it's always really important to confirm, that they are in network. Number 6, keep records. Save all your communications, your appointment notes, your receipts. Have a dedicated folder. Keep your denial letters, keep your approval letters, keep your explanation of benefits from your insurance company. Make sure you have that paper trail. And last 7 is know how you're admitted to the hospital. And we talked about that a little bit. Know if you're in observation versus if you're an inpatient. Being an inpatient for our aging adults, this impacts their ability to get into a nursing home for a short-term rehab stay. Medicare requires that they have a 3 midnight stay in the hospital in order to allow that Medicare rehab benefit. So if you're discharged and want to go to a nursing home and you've only been in the hospital a day, or you're in observation, then it's going to end up being private pay, or unless you have Medicaid or another payer. So it gets really messy. So it's really, really important that you ask questions and ask how this is going to get paid for, and ask if you have any financial risk in any of the treatments that you're going to be receiving. So we share some of the resources. Like I said, we'll put them in the notes. I'll also put it in the video description. So the goal is to improve the prior authorization process, because we want to avoid delaying care. Not Maybe we can hope to eliminate prior authorization for more common procedures, and also minimize the process, removing barriers and reducing the paperwork for our providers to be able to have to fill out, and kind of reduce the amount of hoops that they need to go through to get the approvals. So remember, you're not alone in this maze. The more you know, the more empowered you are to advocate for yourself or an aging loved one. If you need help navigating prior authorization or understanding your Medicare plan, please reach out. We are here to help. And if you found this episode helpful, please be sure to share it with a friend or family that may need it. And don't forget, we're always just a consult away. We have free consultations for everyone. And last but not least, I just want to put in one last plug. This yesterday, we just released our podcast. It's on all the podcast platforms, and it's called Redefining Healthcare, Advocating for Aging Adults and Their Families. Linda and I are doing this together, different topics, different subjects. We're going to have guest speakers. And so I really encourage you to go check that out. So we will see you back next Tuesday for some more Tuesday tips and support. And I'll drop those links in, and we'll see you soon. Take care.